Welcome to Non-Yelloom TV, your one-stop channel for all things health related. We are dedicated to bringing you comprehensive guides that help you understand your body better, promoting healthy living, and providing you with the information you need to make informed decisions about your health. Today, we're going to delve into an important topic that impacts millions around the world, menstrual health. But before we go any further, don't forget to hit that subscribe button and turn on notifications. That way, you'll always stay updated with our latest videos. Now, let's get started on our journey to understanding menstrual health better. Remember, knowledge is power. And today, we are empowering you to take control of your menstrual health. Have you ever wondered why menstrual health is so important and how it can impact your overall well-being? Well, get ready to unravel the mystery, because today we're taking a deep dive into the world of menstrual health. Menstrual health is a topic that holds significance for everyone, not just women. It's a crucial aspect of our biology that affects our health, lifestyle, and overall well-being. Our journey today will help you understand what to expect during a menstrual cycle, the deviations that could occur, and how to navigate through them. We'll also discuss how to maintain a healthy menstrual life, because believe it or not, it's not just about the cycle. It's about understanding our bodies and ensuring they function optimally. For this, we don't need a medical degree, just some basic knowledge and awareness. So, buckle up for an enlightening ride. Stay tuned as we delve deeper into understanding our bodies and menstrual health. The menstrual cycle isn't just about having periods. It's a vital part of a woman's body. It's like a monthly report card that provides insight into overall health and well-being. To understand it better, let's break it down into simpler terms. The menstrual cycle is a roughly 28-day cycle, but it can range anywhere from 21 to 35 days. It's divided into two main phases: the follicular phase and the luteal phase, separated by ovulation. The follicular phase begins on the first day of your period. Your body is shedding the lining of the uterus, marking the start of a new cycle. During this phase, the pituitary gland in your brain releases follicle-stimulating hormone, or FSH. This hormone stimulates the ovaries to mature an egg. The next stage is ovulation, typically around day 14. The mature egg is released from the ovary into the fallopian tube. If you're trying to conceive, this is the optimal time for fertilization. Following ovulation, we enter the luteal phase. The empty follicle, now called the corpus luteum, releases progesterone and some estrogen. These hormones thicken the uterine lining, preparing it for a potential pregnancy. If the egg isn't fertilized, the corpus luteum shrinks, hormone levels drop, and the thickened uterine lining is shed during the menstrual period, starting the cycle anew. It's important to note that everybody is different, and cycles can vary from person to person. Factors like stress, diet, exercise, and overall health can influence the length and regularity of your cycle. In essence, the menstrual cycle is an intricate dance of hormones preparing the body every month for potential pregnancy. It's an integral part of reproductive health and a fascinating insight into the workings of the body. Now that we understand the menstrual cycle better, let's explore what is considered normal and what could be a sign of a problem. Did you know that menstrual cycles can vary greatly from person to person? That's right. There's no such thing as a normal cycle that fits everyone. However, there are common patterns and ranges that most people's menstrual cycles fall within. Typically, a menstrual cycle lasts between 21 to 35 days, with the average being around 28 days. The period itself, which is the bleeding phase of the cycle, usually lasts between 3 to 7 days. The amount of blood loss can range from light to heavy, and it's normal for this to vary between cycles and from person to person. Now, let's talk about deviations. These are occurrences in your menstrual cycle that differ from your typical pattern. They include irregular periods, heavy bleeding, or painful periods. Irregular periods can mean your cycle length varies significantly, you skip periods, or your period comes more frequently than every 21 days. Heavy bleeding, also known as menorrhagia, is when you're changing your pad or tampon every hour for several consecutive hours, or your period lasts longer than a week. Painful periods, or dysmenorrhea, refer to severe and frequent menstrual cramps that may interfere with daily activities. Keep in mind that occasional irregularities can be normal. Factors such as stress, changes in weight or exercise, and certain medications can affect your cycle. However, if these deviations become persistent, they may indicate a health issue such as hormonal imbalances, polycystic ovary syndrome, or endometriosis, among others. It's essential to listen to your body and observe your cycle. If you notice consistent changes or symptoms that worry you, don't hesitate to seek medical advice. Your healthcare provider can help identify any underlying issues and guide you towards appropriate treatment or management strategies. If you're experiencing any of these deviations, it's important to seek medical advice. But what else can you do to have a healthy menstrual life? Maintaining a healthy menstrual life is more than just managing your period. It involves taking care of your overall health. To start with, maintaining a balanced diet is essential. This doesn't mean you should start a restrictive diet or obsess over calories. Instead, focus on nourishing your body with a variety of foods that cover all the essential nutrients. Fruits, vegetables, lean proteins, whole grains, and healthy fats should make up the bulk of your meals. And remember, it's okay to indulge your cravings occasionally, but moderation is key. Next, regular exercise can also play a significant role in your menstrual health. Exercise not only helps to alleviate menstrual cramps, but also regulates your menstrual cycle. Aim for at least 30 minutes of moderate exercise most days of the week. This could be anything from a brisk walk to a yoga session. Now, let's talk about stress. Stress can wreak havoc on your menstrual cycle, causing it to be irregular or even stop altogether. Finding healthy ways to manage stress is crucial. This could be through meditation, relaxation exercises, or simply taking time out for yourself each day. You know what they say? An ounce of prevention is worth a pound of cure. Sleep, oh glorious sleep, is more important than you might think. Lack of sleep can affect your menstrual cycle and make period symptoms worse. So try to get at least 7 to 9 hours of sleep each night. And if you're having trouble sleeping, consider creating a bedtime routine to help signal to your body that it's time to wind down. Lastly, regular health checkups are essential. These visits can help detect any potential issues early and keep your menstrual health on track. So don't skip your annual gynecological exam. Remember, your menstrual health is a vital part of your overall health, so take good care of it. Menstrual health might seem complex, but understanding it is a crucial step towards ensuring your well-being. Let's just quickly recap what we've learned today. We've explored the significance of understanding your menstrual cycle, how it works, and what it can tell you about your health. We've delved into what constitutes a normal cycle and how to recognize deviations that may require medical attention. Lastly, we shared some insightful tips on maintaining a healthy menstrual life, promoting a proactive approach to your menstrual health. It's clear that being well informed about your menstrual cycle can make a world of difference. It's not just about tracking dates on a calendar. It's about understanding your body, recognizing changes, and taking the right steps towards your well-being. Thank you for watching this video on Non-Yellum TV. If you found it informative, don't forget to subscribe and share it with others who might benefit from this information. Remember, knowledge is power. Before we wrap this up, we would love to hear from you. Have you found this information helpful? Do you have any personal experiences or tips you'd like to share with our community? Your feedback where not only helps us to improve, but it also creates a supportive community where we can learn from each other. Please leave your thoughts, questions, or ideas in the comment section below. We appreciate your support and your involvement in this conversation. And remember, the journey towards better menstrual health doesn't have to be walked alone. Let's continue to learn, grow, and support each other together. Stay tuned for our next video where we will delve deeper into women's health issues. Until then, take care and remember, your health is your wealth.